Today we are going to do a procedure called surgical sperm extraction for a patient who is a 30-year-old male. He presented to our clinic with low sperm count and all of the sperms were immotile and there were very few sperms. Immotile meaning there was very little movement of the sperm and all of the sperms were in an abnormal shape and morphology. So when we have examined the patient and he has undergone some tests, we have found out that the cause for this problem was a damage in the epididymis because of a previous infection. Therefore, in order to increase the chances of a pregnancy and a conception, since they wanted to get pregnant since 3 years, but they have been unsuccessful after many treatments so far, we have decided this patient, because his sperm count was less than 1 million per ml, couple have to undergo a procedure called IVF. So for this procedure, we wish to use the healthy and the good sperm because the sperms in a sample are not in a good shape and they are not moving. We decided to do a procedure called PESA, where a small injection needle is passed through the skin into the testis, and in the fluid which we withdraw out, we are able to find plenty of sperms in many of the cases where there is an obstruction. Following PESA, which is PESA, if we are not satisfied with the quality or the movement of the sperm or the quantity of the sperm, we would next proceed to a process called TESA, which is TESA. A small injection needle is passed through the skin into the testicle itself, and the withdrawn fluid aspirated from the testicle is sent for microscopic examination. Then, once we find the presence of sperms in this tissue, the patient procedure is already complete within 5 minutes, and the patient can be discharged without a single incision stitch or a scar. And patient can resume their normal activities within 5 to 6 hours. Only thing that they have to restrain from after the procedure is riding a motorcycle, having sexual intercourse for 7 days. Following TESA, if there is still an unsatisfactory quantity of the sperm, the next step which we would proceed to do is a TESE, that is a TESE. In TESE, there is a 1 centimeter incision which is given on the skin of the scrotum, and following which there is a small nick, that is a small cut on the testicle in order to extract the seminiferous tubules from all the quadrants, left upper, right upper, left lower, right lower of the testicle. All of these tubules are then sent for a microscopy, wherein we will be able to find the sperms in a plenty of quantity. So this is the steps which is required for the male partner.